Thank you so much for joining today's session on green skills for a sustainable future, building a climate smart health and care workforce. Climate change is rapidly becoming one of the greatest health threats in Europe and beyond. Rising temperatures, extreme weather, and shifting disease patterns are putting pressure on our already strained health systems. At the same time, the health sector itself is a big contributor with around 5% of global greenhouse gas emissions, thus creating a dual challenge to adapt and to mitigate. Addressing these challenges requires not only policy reforms, but a health workforce or a workforce equipped with the right skills. This is where green skills come in. And these are skills that include health literacy, or health climate literacy, better put, sustainable clinical practices, public health leadership, and risk communication. Health professionals are in a very unique position to drive low carbon, climate resilient healthcare. But in order to do this, they need the proper skills. Today's webinar will provide you with a solid theoretical background on green skills, what we mean by them, and the frameworks surrounding them. We will also highlight practical examples as to what countries are doing with regards to training and courses offered for health and care workers. And further, we will share new initiatives and projects that are underway. This webinar, just so you know, is part of the BeWell Spotlight series on upskilling and reskilling the European health and care workforce. And for those of you that don't know, and I'm sure Federica will touch on this a bit more, the BeWell project is a European Union initiative focused on transforming the health sector by equipping the health and care workforce with digital and green skills. And also, so you know, the next webinar, so get out your agendas and pencil in May 6th. That's the next webinar in this series. And it's entitled Closing the Digital Skills Gap for the European Health and Care Workforce. And we'll have a little note for you at the end as a reminder. But back to today's agenda, we have a wonderful panel of speakers. And Dr. Andrea Schmidt from the GUK, or the Austrian National Public Health Institute. She's been the head of the newly established Competence Center for Climate and Health since March 2022. And she will kick us off with the keynote for today. She's also the lead author of the policy brief, which this webinar is based around. Then we'll have 3 spotlight speakers as per usual. The first is Professor Ronald Battenberg. He is the leader or the program leader at the Netherlands Institute for Health Services Research, also known as BeWell, and he specialized in the area of human resources for health. And Professor Battenberg will be sharing a case study on the Netherlands with us, specifically focusing on the Green Deal 3.0. Next, we're going to zoom out a little bit and move to Federica Margheri, who is the executive director of EHMA, the European Health Management Association. She, along with her colleagues, have led us through the BeWell project, and she will speak about some of the training courses and the consortium, or that the consortium has provided on green skills. And she will also touch on the importance of green skills and how they fit within the BeWell project. And next, we'll zoom out just a bit further and move to Dr. Petronille Bogart. She's a policy officer at the European Commission, DG Santé, and she will not only tell us about the importance of green skills for the Commission, but she'll also share with us the various activities and projects the Commission is doing around green skills. So I will now turn over to Erica, my lovely co-moderator, and we will have this great poll for you.
Hello, everyone, and welcome. Lovely to see you all there in the chat box. Just a quick poll to see where we are with across Europe and globally. Quick question for you. What is the biggest barrier to implementing climate resilient and low carbon practices in your health system or organization. So is it the lack of funding or resources? Is it insufficient training or awareness among health professionals? Is it limited policy or leadership support? Operational challenges and infrastructure limitations? Insufficient training or awareness among health? Oh, that's gone on twice. Sorry about that. Unclear data or evidence on climate health impacts, or indeed none of the above. Okay, looking forward to hearing where you are with that one. Michelle, back to you in the studio.
Thank you so much, Erica. And without further ado, we will turn it over to Andrea to give us the keynote for today. Andrea, please.
Thank you very much, and welcome everyone to my talk, where I have the pleasure to present on behalf of all co-authors and the BeWell Consortium the policy brief on green skills for a sustainable future, building a climate-smart health and care workforce. So I have three areas on which I'm going to talk. The first one, I will briefly set the scene. I will then present to you the three key capacities for building climate-smart health and care workforce, and share with you some lessons learned from our policy brief. We did primarily an analysis of the literature, but also some focus group that our results are based on. Now, to set the scene, we already heard from Michelle that climate change has been defined the greatest challenge for health systems in the 21st century. And in fact, the European Environmental Agency published a report last year where you can see this graph on the right side. And this is about where does climate change have an impact. And you can see that health is right in the middle of all the areas that are impacted by climate change. And in addition, it produces, we saw in 2022 that climate change also produces high costs. 18.7 billion only in the WHO European region, a lot of which is also uninsured costs. At the same time, 8 in 10 people in the EU agree that tackling climate change and environmental issues should be a priority to improve public health. Now, that's one side of the coin. The other side of the coin, as we already heard, is that health systems do produce greenhouse gas emissions themselves. On the right side, you see here a graph from Healthcare Without Harm with all the different elements where greenhouse gas emissions emerge when we produce healthcare services. Now, what can we do about this? On the one hand, and that's a really important message also for today, we can reduce healthcare demand by improving health. So health promotion is one of the key aspects when it comes to tackling climate change within our health systems. Because it improves population health and makes us more resilient against the impacts. And at the same time, it reduces demand and by that also reduces greenhouse gas emissions. And the second area is to reduce the carbon intensity of the activities that are being produced in our health systems every day. And that can be done by including climate change aspects into existing strategies. Think about quality improvement strategies, strategies to reduce low-value care. These are all areas where we can think about green skills and environmental impact and how to reduce it. Now, when we talk about building the climate-smart health and care workforce, we need to think also that this is part of a broader framework with 10 elements that is part of a framework that was updated by the WHO in 2023. And you can see all the 10 dimensions here on this graph on the right side. And we know that health and care workers are a really important element when it comes to building resilience. Think about the COVID-19 pandemic and their important role. Healthcare workers are drivers for transformation, also in times of multiple crises. Why? Because they're highly trusted figures and they're also much better able to reach vulnerable groups than many other groups and than, for example, also politicians sometimes. Despite this important role, there is currently a gap in education, in training, in curricula, in continuing professional development, in teaching the climate health nexus to health and care workers, in learning about this when it comes to education and training. And that was also one of the main rationales for our work, for our policy brief, where we tried to identify what are the gaps and what can we do about them. Now, I would like to share with you two concepts that we also highlight in the policy brief that are really central here. First, climate health literacy. Climate health literacy means that an individual is able to recognize the direct and indirect linkages between climate change and health, communicate on these risks, assess data, and comprehend also uncertainty, but also to make informed and responsible personal decisions and advocate for broader policies. And this can be linked to the concept of green skills. Green skills includes 4 competencies, includes cognitive, interpersonal, and technological competencies. And so with our policy brief, we link these 2 concepts together, and we do that by considering these aspects for both mitigation, so reducing greenhouse gas emissions, and adaptation, so preparing for the impacts of climate change and responding to them. Now, what can we do to build a climate smart health and care workforce? There are 3 key capacities. The first one, and you can see this here in the graph on the right side, green skills are linking mitigations and adaptation action, and in 3 capacities. The first one is workforce capacity. We could say this is the macro level, sometimes the policy level. We educate. How can we educate sufficient health and care workers? How can we implement policies that support climate resilient health systems and health promotion? Second level, organizational capacity, meso level. So that means also at the institutional level, what can we do? How can we help establish and train green teams? Green teams are usually teams that work, for example, in a hospital and work where medical staff, nursing staff, and administrative staff work together to increase environmental sustainability, but also to allow in these institutions for co-designing new roles, tasks, and profiles. And finally, the capacity for information, awareness, and communication, which we could say is at the micro level, at the individual level, but is also a cross-cutting dimension. And it's really about conveying climate-related risks to other decision makers, to the media, to community leaders, but also to promote awareness within society at large. Now, I'm going to go into each of these capacities in a bit more detail. The first one, the workforce capacity. What can we do to build it when it comes to education and training for our health workforce? It's really about building knowledge across the curriculum. Think about, does the curriculum of your healthcare workforce have include climate-related aspects, and link them to areas such as health promotion, to quality management, and also does it explicitly talk about preventing the harmful impacts of climate change at all care levels. Now, in the policy brief, you find also examples. See, for example, the example of England, where we see the Health and Care Act with the green plans, but also the Green Deal, where we're going to hear about something later. And in the adaptation area, in the cases of Finland, Austria, and Ireland on adaptation and the creation of health national adaptation plans that support these type of skilling initiatives. The second capacity refers to organizational capacity. Here we talk about practical skills. Think about clinical leadership. Think about advocating for environmental stewardship. Thinking about equity and sustainability together within the clinical context, for instance. This is very much about continuing professional development, about upskilling, reskilling, strengthening existing roles of our health and care workforce, but also where necessary to co-design new roles, profiles, and tasks, and think and also allow for input from other disciplines such as climatology. And here we saw in our analysis of the literature that job profiles have been created for the mitigation area, for example, a sustainability manager, but not so much for adaptation, where more action would be needed, for example, assigning a chief heat officer. And you can find examples on that as well. Third one, capacity for information, awareness, and communication. The picture already tells you what this is about. It's very much about teaching also on values and attitudes, environmental justice, but also encouraging students and health and care workers to support national bodies when it comes to integrating climate and health concerns into curricula. And so this is about supporting bottom-up movements. In fact, across the EU, we see that many healthcare workers are part of movements such as Health for Future, Clean Citizens for Planetary Health. And in fact, and you will find that in more detail in the policy brief, there are already some existing frameworks that can help us guide the development of core climate and health skills and competencies. The BeWell project developed a competence matrix that you can find in the policy brief. There is the UK Education for Sustainable Healthcare framework. We have from the US 2 initiatives, the Planetary Health Report Card initiative that provides some guiding initiatives, the Global Consortium on Climate Change and Health that was implemented already in the EU in some countries, and also the European Association of Schools and Programs of Public Health. So check those out if you are interested in also getting active here, and we don't have to start from scratch. That leads me already to my last part. What are the lessons learned that we find? The barriers, the facilitators, and the take-home messages. The first barrier will not be a surprise for you. Health systems are under pressure because we face workforce shortages, there's poor job quality, and there are resource constraints. That also often leads to the lack of a long-term vision. And we know that for tackling climate change, we need a longer-term perspective. At the same time, and in addition, there is often a lack of knowledgeable educators that are actually confident enough to teach health and care workers on climate and health matters. And the message to the researchers out there among you, there is a lack of evidence and knowledge and awareness to support also this implementation and convince people to implement climate smart practices. What are facilitators on the other hand? Policymakers can lead the development of climate health policies, for example, by leading these policies that involve also upskilling and reskilling in co-creation with health and care workers on all these capacities that I mentioned, but also to have a well-funded training approach, for example, train-the-trainer formats and blended learning methods, and to encourage collaboration across professions and generations, and accreditation systems that allow for better intersectoral collaboration between education and health, but also to support the building of a robust evidence base, as I said. What are the take-home messages from this, from our policy brief? First, health promotion is really a central building block. We need health promotion to improve health and deal with the impacts of climate change, but also to reduce the demand for healthcare and reduce emissions. Second, mitigation and adaptation go hand in hand. We cannot only reduce emissions without adapting, and vice versa. And the third one, collaboration across sectors. It's our usual suspect, but it's not easy. And we need to talk across sectors, education, health, and climate, to implement green skills and climate health literacy within our health work and care workforce. And finally, macro, meso, micro, there are the skills building initiatives should really keep in mind all three key capacities of building a climate smart health and care workforce. That leads me to the end, and very much you're encouraged to download also our policy brief and get in touch with me. Thank you.
Thank you so much, Andrea, for this great overview and this wonderful presentation. We've learned a lot about the existing frameworks that are available. We see that reducing healthcare demand by improving health is key, but also reducing climate emissions from hospitals and health systems and services as well. I'd like to go over to Erica now to give us the results of the poll. Thank you, Erica.
Thank you very much, Michelle. Yes, really interesting findings. Perhaps most interesting is that we combined the two questions on insufficient training or awareness amongst health professionals, not necessarily the most scientific approach, but it gives a good indication that this is one of the key factors. Insufficient training or awareness among health professionals, one of the key factors, one of the key barriers to implementing climate resilient and low carbon practices in people's health systems, which shows the importance of and the relevance of research such as this policy brief, but also the wider BeWell project. I would also highlight lack of funding or resources is also one of the well up there. And
Erica, I think it goes really well. This insufficient training or awareness among health professionals is probably also a result of limited policy or leadership support, which can also be linked with lack of funding or resources.
Absolutely. These things are all sort of interconnected, but thank you very much, everyone, for answering that poll. Very interesting findings. Thank you. Michelle, back to you.
Thanks so much, Erica. You and Andrea can turn off your cameras, and I will hand it over to Ronald to give us a case study on the Netherlands. Thank you.
Thank you, Michelle, and thank you for this opportunity to present this as a few words. I only have 5 minutes to the Dutch situation and the Dutch initiatives with regard to sustainable healthcare. And I would particularly want to focus with you shortly on what is also addressed in the policy brief that is at the center of this webinar, the box on the Netherlands. There it describes the Green Deal on Sustainable Healthcare 3.0 or 3.0, initiated in 2022. And if you look at this Green Deal, then it actually contains many of the aspects that has been presented already by the previous speaker. And but a specific part of this Dutch Green Deal on sustainable healthcare, linking to health and care workforce, is this knowledge and awareness. And this is again closely related to training and awareness, which came out as the most important barrier or facilitator of the poll we just saw. So this Green Deal in the Netherlands has been supported by many large healthcare organizations and has 5 themes: health promotion, knowledge and awareness, CO2 reduction, circular, and medicines. And like I said, the focus of my short presentation will be on knowledge and awareness, and because that is specifically addressing the role of the health and care workforce. And I must admit that we don't have solid indicators for this right now, but it's commonly acknowledged that the knowledge and awareness of the Dutch health and care workers is growing. And what sustainable and the climate crisis means for healthcare, that is included what planetary health actually is, and of their own individual footprint by the choices health and care workers make, and intendedly or unintendedly. And as with every change and innovation, we know it's hard to get a concept like planetary health implemented, as it needs to fit in current processes and often inert systems. And so therefore, the role of education and training of the future health and care workforce is critical. And this is the workforce that will set changes and adaptations in motion. And in the Netherlands, since last year, all academic medical centers committed to give a planetary health more attention in medical education. The slogan is "Put a planetary lens for students." And from our HRH, or Human Resources for Health perspective, this is particularly also interesting because it gives also a new boost on interprofessional training and cooperation. Because to understand and innovate health services from a sustainability perspective, this typically requires multiple disciplines, such as medicine and healthcare, of course, and health services research, but also business administration, technology, biomedical sciences, and others. And now it looks like that if we talk about these initiatives, the higher educated health and care workers, or physicians, and the larger healthcare organizations like hospitals are the most relevant for training in sustainability. But obviously, it's relevant for all healthcare sectors at all levels. So I would like to mention another example from the Netherlands, which is an initiative of general practices, GP practices, being merely small-scale organizations in primary care. To give you an impression, there are 70 million inhabitants in the Netherlands, and we have about almost 9,000 of these GP practices that employ 13,000 family physicians. And already before the Green Deal 3.0, the Green General Practitioner.nl was founded in 2019 by a group of enthusiastic general practitioners, and their mission is to increase knowledge and exchange between general practices on a regional scale and to realize green primary care by, for instance, evaluating among each other drug prescription protocols, but also to organize external services that take care of the greening of the general practices. And so that is energy, water, paper, and waste management. So that is externally served and not at the shoulders of the general practices and their work force themselves. So training is important here. So the new generation of health and care workers is a spear point also of this Green General Practitioner.nl. So primary care doctors and nurses and primary care healthcare assistants are now trained in sustainability and planetary health as part of their curriculum. And next to this, of course, there are webinars, e-learnings for all general practices currently.
Thank you. Ronald, I'm going to stop you there just because this is a lot of information and this is a lot of great information coming from the Netherlands. Thank you so much for sharing. I think knowledge and awareness out of the 5 points that you initially mentioned from the Green Deal is absolutely key. And that's probably one of our biggest problems moving forward. Education and training is definitely a solution. Starting in universities is a good first start, but as we see, the Netherlands is already a bit more advanced, moving to hospitals and general practices, GP practices as well. So thank you very much. We're going to zoom out from the case study perspective and move over to Federica from EHMA. And I turn over the floor to you. Thank you.
Thank you. Thank you very much, Michelle. And thanks for the opportunity to give a little bit more background on the BeWell project that led to the development of this policy brief that we heard more detail from Andrea a little bit earlier. So we know and we have heard that climate change is not just an environmental issue. It is a health crisis, and health systems clearly need to adapt and reduce their own carbon footprint. So again, the need for mitigation and adaptation, but these can really only happen if the people that are behind the system, so our health and care workers, our care assistant, our nurses, our doctors, and everybody that really works in health and care systems are equipped with the right skills. And this is how the BeWell project came about. You have heard it before. It is supported by the European Union. It is specifically supported by the Erasmus Plus funding scheme. And this is a project that aligns both with European climate goals, but also the European skills agenda, because it really aims to define, develop, and deliver the green skills that our health and care workers need. Now, to remain very much in line with the outcomes of the poll, with what has been mentioned before, one of the challenges that we faced very early on in the project was that there was an evident lack of knowledge and awareness around green skills, but also green trainings on green skills. And if it's not scarce, definitely it is scattered. Where these trainings are, it's not known to many. And so to respond to this first challenge, we created through the BeWell project a skills monitor. And so this is an interactive tool, and I think that a link will be posted into the chat where we are mapping what are climate health related trainings across Europe. It is not just a repository, although you can find information about different trainings free of charge from different countries in different languages or that are connected with different education programs in university or VT. So it is a very good repository, but it's much more than that, because this skills monitor is also a resource for policymakers, for curriculum planners, for anybody who works in education, because it helps them identify gaps, fill these gaps, and also drive improvement. But also to remain on the concept of that awareness is not enough around the green skills. Clearly, it's evident that they are not as well known as other skills, whether they are soft skills, clinical skills, or digital skills. And so for these reasons, the BeWell project then developed competencies matrices that identify what are the needed competencies from sustainability knowledge to practical skills in health settings. And it is based on these matrices that the BeWell project has developed a suite of online courses. These are accessible on our website. They are flexible, they are online, they are available in multiple languages, and they are really designed to support lifelong learning. And among the projects we have, for example, pollution and health, or green skills for frontline nurses and allied healthcare professionals. We also have a course on health systems and environmental health, and another course on green skills for the health sector. And these courses will help health and care professionals move from awareness to action, and will also make them able to embed sustainability into their daily practice. And so to conclude, the BeWell project has given us the opportunity to really develop framework tools and training to build a workforce that is not just climate smart, but is also capable to shape solutions.
Thank you so much, Federica, for this great overview. And I would like to again direct you to the chat where Erica has so kindly posted the two links that Federica mentioned. One to the skills monitor, where you will really find all of the different training courses out there at the moment for the health and care workers, and also to this suite, as Federica called it, the suite of online courses that have been developed by the BeWell Consortium. I do very much encourage you to check those out. Thank you so much, Federica. And now we will zoom out just a bit further and get the Commission's perspective. Petronil, I turn it over to you.
So good afternoon, everyone. Thank you so much for joining this important discussion on green skills in the health workforce. So also for the Commission, this is a really important topic, and this has been underscored with a significance through the work of the renewed Union of Skills Initiative. So the renewed Union Skills Initiative has been published earlier last month, and it highlights the needs to upskill and reskill the workforce in various sectors. And this, of course, includes the health sector and healthcare. Green skills are crucial not only for successful green transition and a robust circular economy, but also for enabling our systems to adapt effectively, as discussed by the previous speakers, to the challenges posed by climate change. And climate change is one of the important factors affecting people's health and impacting our health systems. So health facilities across Europe significantly contribute to carbon emission and environmental pollution, accounting for more than 5% of the net global emission, as some of the previous speakers mentioned. And this really presents a critical need for greening the health sector. So what can we do, and what has the Commission done so far? So by implementing sustainable practices such as reducing waste generation and pollution, conserving energy, decarbonizing, and promoting sustainable procurement, health systems can substantially lower their environmental footprint. And green skills are fundamental here. They really enable healthcare professionals to drive the sector's transformation towards sustainability. So equipping health professionals with green skills is for us not just a technical upgrade, but it's really a strategic shift. And these skills enable healthcare workers to respond to climate threats, reduce emission, and embed sustainability into everyday practice. And this can only happen by successfully and strongly engaging the health workforce. So I would like to highlight the work of the BeWell project. I was one of the key examples of the Euro Commission engagement to align workforce skills with environmental goals. So the European Commission funds the BeWell project through the Erasmus Plus program. And BeWell plays an important role in shaping green skills with the health workforce. So they've brought together key stakeholders in the field and really developed the concept, because I think green skills are still not very well understood by everyone in the field. And it's actually a concept still in development, I would say. So it offered a structured discussion and a structured approach to integrating these competences and skills into educational frameworks and training programs. And by identifying new and emerging occupational profiles, as BeWell just presented, they also ensure that the workforce remains agile and responsive to innovative roles and centered on sustainability, as we are in a changing environment. So what else is the Commission doing? The European Commission is committed to the sustainable transformation. So through the upcoming EU Climate Adaptation Plan and the reinforced focus on the European Climate and Health Observatory, the Commission integrates health into the heart of Europe's climate agenda. So the European Climate and Health Observatory was launched in 2021, and it's a concrete expression of this commitment. It brings together leading European and international partners to translate climate data into actionable health intelligence. So it supports national and local authorities with tailored information, interactive tools, and real-world case studies to guide planning, education, and capacity building. What else? So furthermore, various EU instruments provide support for greening health systems. For instance, many member states within their national recovery and resilience plans have earmarked investments to enhance the energy efficiency of hospitals, primary care, and community care facilities, alongside investments in clean mobility, for example, through electric vehicles for healthcare delivery. And then finally, what other routes can we take? As mentioned by Andrea previously, we can also adopt greener models of care. This offers another promising avenue. So this approach emphasizes disease prevention, shift activities from hospitals to primary care setting, and scales up the use of telemedicine. And we have various EU programs which support these initiatives. So these steps not only contribute to the reduction in emission, but also enhances the efficiency and reach of healthcare services. Also, this requires strengthening of digital and green skills in the health sectors. So in closing, as we progress towards the sustainability goals, upskilling and reskilling in green skills is not merely adventurous, but it's imperative for the health sector. Health professionals are among the trusted figures in society, and empowering them with green skills means they can lead by example, not only protecting patients, but championing sustainability across communities. And with initiatives like BeWell, we're taking steps towards transforming our health systems to reduce environmental impact and be more climate resilient, and ultimately benefiting both people and the planet. So thank you for your attention. I look forward to our continued discussion on advancing green skills in the health sector.
Thank you so much, Petronilla, and thank you for sharing with us the Commission's perspective and also all the activities and initiatives that they are undertaking surrounding green skills, particularly, and I saw briefly that this was one of the questions in the chat, funding the BeWell project so that we were able to come up with these courses for the health and care workforce. So now I'd like to invite all the panelists to please turn on their cameras, and I will turn it over to Erica to deliver some questions from the audience, as I see the chat has been very active.
Yes, thank you very much. Wonderfully active chat box. Very nice audience today who've been very, very complimentary about our speakers, which is really lovely. Going to kick off with three quite fundamental questions that have come up through the chat. Firstly, where should we be getting the funding for these green skills courses? Where should the money be coming from? I suppose that's one of the most fundamental things. Quite rightly, someone has asked also, is this work to be done on top of the existing workload for the healthcare workforce? Or, is it on top of that? Is it in addition to that? Or is this, are we looking to actually take something off their shoulders so that they can do these can apply these green skills? And, to ensure sustainability of this project, as it were. And then absolutely fundamental, how do we evaluate the effectiveness of green skills integration? So both in terms of the climate resilience of the health system, but also in terms of the health workforce preparedness. So over to you. I'm going back into the chat box now.
Thank you so much, Erica. Is there anybody that feels inclined to take one of these questions? Please just unmute yourself and.
I can take one of the questions if you like. I don't want to step ahead of anyone.
Go for it, Andrea,
Yeah.
please.
Okay, thanks a lot for these questions and very valuable. So regarding the funding question and also link to it a little bit, how can we basically put additional burden on the health workforce, which is a question, of course, that we receive quite often when we talk about this. And I work also at the national level on implementing climate literacy courses, and so I can also speak a little bit from that perspective, not only from the researcher's perspective. So I tried to highlight it also in the presentation, but sometimes it's not necessarily something that comes on top. It's something that needs to be integrated within other strategies that are already helping us to make our health systems better. I think this is really central, that we don't see climate resilience and low carbon activities, but also the skills building needed for it as something separate from the rest. So when we talk about climate resilience, this is part of general health system resilience. Let me give you two examples. First, the quality management strategies. All clinical institutions, all long-term care providers, everyone in the health system has quality management and quality strategies. And we are all interested in avoiding low-value care that might be even harmful, not only to our purse, but also to our patients. And so a reduction of low-value care is one way to also work on environmental sustainability, because if we avoid, for example, polypharmacy activities, so to over provide, so to say, medication to patients and clients. This is one way, for example, to reduce the carbon footprint of patients. But many times it's not thought about in terms of environmental sustainability. So there are strategies that already exist that we can link to the topic of climate, health literacy and green skills. That's the first one. And then the second one is really, again, to stress the topic of health promotion, and really to say that health promotion can be very easily linked also to the topic of mitigation. And if you think about nutrition recommendations, reducing the amount of meat that we eat will not only be good for your health, but it will be also very good for a climate. So if we make our health and care workers aware of these linkages, it will be also credible and easy for them as highly trusted figures to convey these messages. Just to give two examples. I can also say something on the evaluation, but I want to have also maybe someone else wants to step in.
Thank you. The awareness and the knowledge increasing are key topics that are coming out again and again here. Does anybody else want to pick a question? Or Federica, I see you nodding, please.
Yeah, thank you. Thank you so much, Michelle. I think that I wanted to reference again the BeWell project. I mean, of course, we focus about the trainings, but the overall aim of the BeWell project is to develop a skill strategy for the health and care workforce for Europe. And one of the discussion, of course, that is important in building this skill strategy is also to be able to make the case for upskilling and reskilling in green skills in this specific case. So one of the parts that we were discussing internally just a couple of days ago was really about how do we measure how are we able to make a case for these upskilling and reskillings, and this comes indeed from measuring from what is the impact of this training on the workforce, on the health and care sector. And so, of course, I do not have an answer right now in terms of what are the measures, but definitely this is something that the BeWell project will be looking into so that we can provide policymakers, but also managers in different health and care facilities with the frameworks to make the case for upskilling and reskilling the health and care workers in green skills. And this also connects with funding, because it is easier to get funding if we are able to show concrete return of investments. So this is something that the BeWell project will definitely be working on, and you can have all the updates by following us on the project website that has been shared in the chat.
Yes, that's a great opportunity to plug again the links that are shared with you in the chat to go check out the BeWell project. Ronald, I think that you wanted to say something as well.
Yeah, thanks, Michelle, and thanks also for the great questions. In line with my colleagues, I would say that, of course, financing issue is always there, of course. But in fact, if you look at what was rightly said, also, should it be already part of the undergraduate curricula, like Filipa Costa is stressing? I think that comes with a cost, but also is a decision that educational institutes need to make, right? In composing their curriculum, adapting their curriculum. And I'm not saying that this is not costly at all, but it's a matter of attention and time, which should be reallocated actually in the education institute. So it's a big responsibility, I think, for them, either nursing school, medical schools, or those who do vocational educational training. So that is on the financing point. And with regard to the evaluation point, that's, of course, that's a hard one in terms of how to measure the impact. I know there are systems for this, but one thing is important is comparing. Comparing and intervention between professionals also make professionals already aware. For instance, in the case of medication prescription of GPs, so why does the one GP prescribes in this way and the other in a different way? And simply comparing the decisions that are made on a daily basis, and I'm talking about the decisions with regard to what is carbon footprint, can also increase this awareness and this change. But I also agree that not every additional skill should be on the shoulders of healthcare professionals. Please let other external organizations take these tasks and serve the professionals in this new role. Thank you.
Thank you so much, Ronald, and you make a great point. We don't want to place the entire burden on health and care professionals. It's just that this session happens to be about them. So that's why we're specifically putting a bigger emphasis on that. But you're absolutely right. That's something that we definitely need to keep in the back of our minds. Petronil, did you want to say something?
Yes, I just want to add in that we're very conscious. We know indeed that there's a 1.2 million shortage of health workforce in Europe at the moment. So this is a very important issue that we're all facing together, and we're trying to find solutions for. So we have various activities within the European Commission where we're trying to support countries. We have nursing actions that we're working together with WHO. We have training programs that we're doing both on digital skills and green skills as well, to try to upskill and reskill the workforce to be able to be taking advantage of the innovations that are coming ahead of us. So we're very conscious of that, and I think it will require a significant effort to be able to combine these different issues that we're facing, and take this on top of the shortages and the increasing pressure on health systems. Thank you.
Thank you, Petronille. And I'm wondering if, Erica, we should do maybe another round of questions, since there are so many.
Yeah, very lively chat.
Sorry, can I just say one thing on the indicators? Just maybe to post, there is already a little bit of work, and I think that there is still much more needed. But yeah, I don't know if everyone knows about the Lancet countdown indicators. So I think that's one starting point also to work on evaluating the success. But I think we need to link it still better to skills and training initiatives there, and outcome oriented, especially in the field of adaptation. I'll put the link there in the chat.
And I'd like to thank Franziska for adding the technical support instruments. So indeed, we have 2 streams within the Commission where we're supporting countries. So one of them are like where multiple countries work together through projects, and the other one is where there's specific funding that is country specific, so that runs through different countries, and one of that is the technical support instrument, and the other one, which I mentioned, is the recovery and resilience facility, where we're supporting countries through their dedicated recovery and resilience plans. Thank you.
Okay. So we haven't got much time, so I'm just going to pick out 2 little questions. One is about whether or not we need to think about including environmental impact into EU health technology assessment regulation as standard, but also with the sort of like wider BeWell courses, they're targeted towards health workforce in the European Union, but could they also be useful for people beyond that in sort of low middle income countries, particularly in the global south? So a couple of little questions to finish on.
Okay, just so we don't run over, perhaps we can do a round table, just a 1-minute response to whatever question tickles your fancy, and then we can close out. Who would like to? Federica?
I'm very happy. Oh, sorry, Andrea. I'm very happy to take the one on the BeWell courses, which I also responded in the chat very briefly. Of course, the BeWell courses have been developed by a consortium that is a European consortium. So clearly, the great developers behind the trainings are from European countries, and they are, of course, based on the experience and the context in European countries. However, we believe that these are very widely implementable trainings. Of course, they are not context specific, but they can be of inspiration and then tailored for other different contexts. They are available in different European languages, but again, there is the available courses in English, so that will definitely facilitate access.
Thank you, Federica. Andrea, did you want to step in?
I wasn't sure what was the first question.
Erica, could you?
It was about whether or not environmental impact should be integrated into EU health technology assessment regulation. Okay. You don't have to answer it if you don't want to.
Yeah, no, I wanted to respond to that one because there is a white paper that was published recently from the International Association on Health Technology Assessment. So I think that could be a really interesting starting point, because yes, I do think that that's a really important way to go ahead to really integrate environmental sustainability within every aspect of HTA, or some aspects, because of course it's not an easy task to do. So thank you for that question.
Thank you, Andrea.
I will put the white paper link there.
Lovely, lovely. Ronald, Petronille, did you want to add some closing statements if you don't want to directly respond to any of those 2 questions? Ronald?
Yeah, well, if I may, what triggered me is also the suggestion on who should train and who should train the trainers, and that's an interesting one, but also stresses that this is collaboration. And I also mentioned about interprofessional collaboration with other disciplines from business administration, technology, obviously, and climate experts, but also between professions. So this is an opportunity, and this is an area in which doctors and nurses and healthcare assistants, so throughout all the health workforces, collaboration and collaborative action and awareness is a great opportunity also to sit together and to discuss throughout all the different health workforces we have how to move forward. Thank you.
Thank you, Ronald. Petronil, did you want to add anything?
No, I just wanted to confirm what Ronald was saying, and indeed that this is something that needs to be addressed by working also together with the different sectors, as obviously they're very much interlinked. Thank you, Michelle.
Andrea, Federica, any last words before I close out?
I honestly think that we need to get better in considering the needs of low and middle income countries. So this is definitely a very fair point. And in fact, when it comes to climate adaptation, there's a lot that we can learn from countries in the global south. So that's, I think, not a one-sided way of learning. That's also important for me to say, especially when it comes to heat adaptation, for example.
Thank you very much, Andrea, for making that point, because in the BeWell project, we're focusing mostly in European countries. So we're not focusing on the low and middle income countries from which we can learn a lot from. So thank you all. We've heard about very many resources for existing frameworks to guide the development of green skills. We've heard from a country that's already doing a really good job in increasing knowledge and awareness of green skills through the Green Deal 3.0. Then we have been given, thanks to the BeWell project, new resources as to where we can find existing and also new training courses for green skills. And finally, we have heard the different continued initiatives being pursued to keep this topic present and increase its awareness among policymakers, health and care workers, and all those beyond. So thank you very much for your time. I just want to make one more plug beside the webinar on May 6th that is continuing with our BeWell series. There's a webinar next week on Tuesday, April 29th. It's not part of the series, but nevertheless very interesting. Please join us for that. It will be on improving access to preventative services for vulnerable children and adolescents. And with that, I would like to leave you and wish you a wonderful day. Thank you so much to our panelists, and thank you so much for joining us.